Welcome back to Calm Mind and Healthy Body, our channel. Today we're diving into a crucial topic affecting millions worldwide: osteoporosis. In this video, we'll explore osteoporosis, its impact on bone health, and why it's essential to understand its causes, symptoms, and treatments. Osteoporosis is a condition characterized by low bone density, which weakens bones and makes them more prone to fractures. It often goes unnoticed until a fracture occurs, severely affecting an individual's quality of life. Understanding osteoporosis is vital because it can significantly impact bone health. Our bones naturally lose density as we age, but for those with osteoporosis, this process is accelerated, leading to increased fragility and a higher risk of fractures. By learning about osteoporosis, we can take proactive steps to prevent and manage this condition effectively. In this video, we'll delve into the causes of osteoporosis, which can range from hormonal changes to lifestyle factors like diet and exercise. We'll also discuss the common symptoms to watch out for, such as back pain, loss of height, and fractures that occur with minimal trauma. Moreover, we'll explore the various treatments available for osteoporosis, including medications, dietary changes, and exercise routines that can help improve bone density and reduce the risk of fractures. Bone health is a crucial aspect of overall well-being that often gets overlooked. Our bones provide structural support, protect vital organs, and play a significant role in mobility. We can lead active, fulfilling lives when our bones are strong and healthy. By raising awareness about osteoporosis and its impact on bone health, we hope to empower you to take charge of your well-being and make informed decisions to protect your bones. Stay tuned as we uncover the essential information you need to know about osteoporosis and how to maintain strong, healthy bones for life. Understanding osteoporosis. Osteoporosis is characterized by low bone density and an increased risk of fractures. Bones become porous and weak, making them more susceptible to breaking even with minor falls or bumps. This silent disease often progresses without symptoms until a fracture occurs, highlighting the importance of early detection and prevention. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. Osteoporosis is when bones become weak and brittle, increasing the risk of fractures. Understanding the causes and symptoms is crucial to protecting yourself and your loved ones from this silent threat. What causes osteoporosis? Factors like aging, hormonal changes, and lifestyle choices play a significant role. Bone density naturally decreases as we age, making us more susceptible to fractures. Hormonal changes, especially in women during menopause, can also contribute to bone loss. A poor diet lacking calcium and vitamin D, and a sedentary lifestyle can further weaken bones. Several factors contribute to the development of osteoporosis, with aging being a primary risk factor. Our bones naturally lose density and strength as we age, making them more vulnerable to fractures. Hormonal changes, particularly in women during menopause, can also play a significant role in the development of osteoporosis. Estrogen, a hormone that helps maintain bone density, decreases during menopause, leading to accelerated bone loss. Lifestyle choices such as a sedentary lifestyle, poor nutrition, smoking, and excessive alcohol consumption can also contribute to the development of osteoporosis. Lack of weight-bearing exercise, which helps stimulate bone growth and maintenance, can further exacerbate bone loss. Additionally, a diet low in calcium and vitamin D, essential for bone health, can weaken bones over time. Genetics also play a crucial role in predisposing individuals to osteoporosis. A family history of the condition, especially a parent who has had a hip fracture, can increase the likelihood of developing osteoporosis. Genetic factors can influence bone density, bone structure, and the rate of bone turnover, all of which contribute to the risk of fractures. By understanding the definition of osteoporosis and the various factors contributing to its development, we can take proactive steps to prevent and manage this condition effectively. Stay tuned as we delve deeper into osteoporosis's causes, symptoms, and treatments to empower you with the knowledge needed to protect your bone health and overall well-being. Osteoporosis can be caused by a combination of factors contributing to low bone density and increased fracture risk. Understanding these primary causes is essential for preventing and managing this condition effectively. Calcium is a crucial mineral for bone health as it helps build and maintain bone density. Without adequate calcium intake through diet or supplements, bones can become weak and porous, increasing the risk of fractures. Vitamin D plays a vital role in calcium absorption, and a deficiency can further impair bone health by limiting the body's ability to utilize calcium effectively. Hormonal imbalances, particularly in postmenopausal women, can also significantly impact bone health and contribute to the development of osteoporosis. Estrogen, a hormone that helps maintain bone density, decreases during menopause, leading to accelerated bone loss. This hormonal shift can weaken bones and increase the risk of fractures in women as they age. Certain medications and medical conditions can also increase the risk of osteoporosis by affecting bone density and strength. Long-term use of corticosteroids, commonly prescribed for conditions like asthma and rheumatoid arthritis, can lead to bone loss and increase fracture risk. Medical conditions such as hyperthyroidism, celiac disease, and rheumatoid arthritis can also impact bone health and contribute to the development of osteoporosis. By understanding the primary causes of osteoporosis, including inadequate calcium intake, vitamin D deficiency, hormonal imbalances, medications, and medical conditions, we can take proactive steps to protect our bone health. Stay tuned as we explore the impact of these factors on bone health and discuss strategies for preventing and managing osteoporosis effectively. Symptoms of osteoporosis. Osteoporosis is often called a silent disease because it typically progresses without noticeable symptoms until a fracture occurs. However, there are common signs and symptoms that individuals should be aware of to detect osteoporosis early and prevent complications. One of the primary symptoms of osteoporosis is back pain, particularly in the lower back. This pain may persist and worsen, indicating weakened vertebrae due to bone loss. Individuals with osteoporosis may also experience a loss of height over time, as compression fractures in the spine cause a gradual decrease in stature. Another critical symptom of osteoporosis is an increased susceptibility to fractures, especially in the hip, spine, and wrist. Fractures resulting from minor falls or everyday activities can be a red flag for weakened bones and should prompt further evaluation for osteoporosis. Due to the lack of early symptoms, osteoporosis can go undetected for years, leading to a higher risk of fractures and complications. This is why it is crucial for individuals, especially those at higher risk, to be proactive in monitoring their bone health and seeking medical advice if they experience any potential symptoms of osteoporosis. Suppose you are experiencing persistent back pain, noticing a gradual loss of height, or have recently suffered a fracture from a minor incident. In that case, it is essential to consult with a healthcare provider. Early detection and intervention can help prevent further bone loss, reduce the risk of fractures, and improve overall bone health. By being aware of osteoporosis's common signs and symptoms and seeking medical advice promptly, individuals can take proactive steps to protect their bone health and well-being. Stay tuned as we discuss the importance of effective early detection and treatment in managing osteoporosis. Treatments for osteoporosis. Managing and improving low bone density in individuals with osteoporosis involves a comprehensive approach that includes lifestyle changes, medications, and regular monitoring to prevent fractures and maintain bone health. Let's explore the various treatment options available for managing osteoporosis effectively. One of the cornerstones of osteoporosis treatment is making lifestyle changes that support bone health. Regular weight-bearing and muscle-strengthening exercises can help maintain bone density and reduce the risk of fractures. A balanced diet rich in calcium and vitamin D is essential for bone health, as these nutrients play a crucial role in bone formation and maintenance. Supplements may be recommended for individuals with difficulty meeting their calcium and vitamin D needs through diet alone. In addition to lifestyle modifications, medications may be prescribed to help manage osteoporosis and reduce the risk of fractures. Bisphosphonates are a typical class of drugs used to slow bone loss and increase bone density. Hormone therapy, particularly estrogen replacement therapy for postmenopausal women, may also be considered to help maintain bone density and reduce fracture risk. Regular bone density screenings, such as dual-energy X-ray absorptiometry (DXA) scans, are essential for monitoring bone health and assessing the effectiveness of treatment. These screenings can help healthcare providers track changes in bone density over time and adjust treatment plans accordingly to optimize bone health and reduce the risk of fractures. Regular follow-up care and adherence to treatment recommendations are crucial for effectively managing osteoporosis. By combining lifestyle changes, medications, and ongoing monitoring, individuals with osteoporosis can take proactive steps to protect their bone health, reduce fracture risk, and maintain overall well-being. Understanding osteoporosis's causes, symptoms, and treatments is essential for maintaining bone health and reducing the risk of fractures. It's always possible to prioritize your bone health. Protecting your bones through lifestyle modifications and medical interventions can reduce the risk of fractures, maintain bone density, and lead a healthier, more active life. We encourage you to prioritize your bone health by incorporating exercise, a nutritious diet, and regular screenings into your routine. Remember, early detection, prevention, and treatment are essential to effectively managing osteoporosis and preserving bone health for the long term. Thank you for watching, and we hope this video has empowered you to take control of your bone health. Stay tuned for more valuable insights and tips on maintaining a healthy lifestyle.